A patient whose identity has not been revealed was found unconscious, declared dead by the paramedics that found the person, and was taken to Darlington Memorial Hospital in England by the paramedics a few weeks ago. The twist to this story was that a few hours later, this patient that was declared dead woke up. It was found out that the paramedics mistakenly declared the person dead. The family had received a formal apology, and as at the time of shooting this video, investigations were ongoing to find out what caused such a serious error. Because as health workers, mistakenly declaring someone who is not dead as dead is a serious mistake. So how do we know that someone is actually dead? You should understand that we don't declare somebody as dead based on some hunch. It's not because we have seen plenty dead people and then we just say, this person is dead. No, medical practice is a scientific practice. So there should be reasons for everything you do. That's the point of today's video. Let's find out. Clinical death is the medical term for the cessation of blood circulation and breathing. These two are necessary for life to continue. Even with the cessation of circulation and breathing, there are things as health workers, especially doctors, since we're the ones that usually certify an individual to be clinically dead, there are things that we look out for. The first sign we look out for is that the person at the onset of clinical death should have lost consciousness. This means that the person is unresponsive to any form of external stimulus, such as touch, voice, or pain. So you call out the person, you touch the person, and try to elicit pain. An unconscious person would not respond at all. But that on its own does not mean that someone is dead. And we move on to the second sign we look out for, which is the absence of a pulse, heartbeat, and respiration. So someone can be unconscious but still have a pulse from an active heartbeat. That means the heart is beating. And the person could also be breathing. So usually we feel for the carotid or radial pulse. Let me demonstrate how we feel for the carotid pulse. This is your throat, your trachea. You just come to either side, the left or the right, and just move your hand just to the side of the trachea. You're going to feel the pulse. Then the radial pulse is that we usually place our hands on the radius. This is the radius, and you're going to feel the pulse. Anyone whose heart is beating will always have a pulse, whether it's weak or strong. You still feel the pulse on these sides. Then to confirm whether the person is breathing or not, we usually place our hands directly in front of the nose. Place your hand directly in front of your nose and breathe. You feel the warm air coming out. For anyone that is breathing, you would always feel that. So apart from obviously looking at the chest rising up and down, you also put your hands in front of the nose to feel the air too. It's more objective because sometimes you might not be able to see the active chest movement during respiration. Then to listen to the heartbeat, we usually use our stethoscope. As my younger brother used to say, our ear to heart something. In a dead person, none of this will be present. The third sign we look out for is that the person's pupils, not students, the pupils in their eyes will become fixed and they don't react to light at all. Usually the pupils in the eyes increase in size when the environment is dark to allow more light enter the eye so as to help us with our vision. And the same pupils constrict as shrink in bright environments to minimize the amount of light entering the eyes so as to help our visions too. This phenomenon is due to the function of the oculomotor and optic nerves of the eye and also the brainstem. And we test this function by shining light in front of the eye. For anyone that these nerves and the brainstem are functional, you'll find that when you shine the light in front of the person's eye, pupils constrict, and by the time you move the light away from the person's eye, they dilate. For a dead individual, all this don't happen. The pupils become fixed, and irrespective of how you shine the light, they don't react at all. The next sign we look out for is the absence of all reflexes in the body. Reflexes are involuntary body movements due to external stimuli. For example, if you mistakenly step on a hot or painful object, you immediately jump. This is a reflex reaction because you didn't think about it. It's your body's response to that. There are multiple reflexes in the body, such as the knee or ankle jerks. A dead person has none of these reflexes. Then the last sign that we look out for is rigor mortis. This is the stiffening of the muscles due to some chemical changes that occur in the muscles after someone has died. It starts a few hours after death and usually resolves between 24 to 48 hours after the time of death. So depending on when the dead body is being brought, there may or may not be rigor mortis. It's within the time frame you'll notice the stiffening of the body, and if it's either before or after the time of rigor mortis, the stiffness disappears on its own. So when an unconscious person is being brought to us, which we suspect to be dead, we look out for all these signs before we declare him or her as dead. When all these are present, we are confident to say that person is clinically dead. This is basic knowledge for all health workers, and making an error of this magnitude is usually very serious. And the reason we go through all this is to know whether to resuscitate resuscitate or not, because there's no point in resuscitating a dead person. Nothing will be reversed. And you save your energy and time to attend to those that will need you, because you know that till date there aren't enough health workers. So I hope you've learned something for today's video. If you did, please give it a thumbs up, and if you're yet to subscribe and you enjoyed this video with other contents that I make, please subscribe and turn on the bell notification. Thank you, and I'm going to see you in my next video. Bye.